phone number, age. Born age. Gender male. Emergency height, put your height, your weight. No need. Just fill this.
Do you know about?
Do you know about Hijama? Yes. You can just mark here. When was your last session of Hijama? Did you feel better after it?
13 years ago.
Yeah, you can say 15. What are your expectation and desire?
كيف يعني شو توقعاتك؟
Yeah.
حط good.
Feeling better. Yeah.
better كيف تنكتب BI؟
BTTER. بعدين have you eaten any food in the last 2-3 hours? No. Just say no, yes, no. One, this is no, this is yes. Just you can mark. Yes, no.
Are you
diabetic? عندك سكري؟ No. Are you pregnant? No. عندك anemia or blood inflation? No. Do you have low pressure blood? Do you have any seizure or disorder? No. Do you have any allergies or whatever? No. Any hearing problems?
any genetic or شو؟
Bleeding disorder? No. Any addiction, drug smoking? Smoking? You smoke? Any surgery? Okay. No. So I have the responsible for the blades, gloves, small tray, blades, coconut oil, cotton, small alcohol pads, big one, hygiene, hand sanitizer, napkins, cups, and we have some foods and olive oil, of course, water and dates. Make sure to sanitize the bag. For the holes, make sure to cover all the edges or anything that the body might touch. We also make sure to wash our hands before we start. I don't know, okay. So right now, what we're gonna do is we're gonna rub the patient body with some olive oil, so we can start the massage covering. So we're gonna dip our finger inside for contamination. So what we're gonna do is we're gonna pour on our palm. As much as you can with his body. And I'm gonna start just do some tapping. We don't need to rub it so the body doesn't absorb it. And he already had the intention, and we had the intention, and inshallah, the hijama will be good recovery for him, inshallah. And we tell our patient to start doing the ruqya, class some Quran, inshallah, Surah Al-Kahf in akhir. And then we start. Just make sure to cover all the areas where the cup is going, so we don't have any issues. Anyway, I already sanitized my hand before touching anything. I just forgot to mention that. I'm going to do it one more time after I pour some oil. Make sure sanitize. So for the moving cupping, we don't need, as an option whether to wear gloves or not. That's up to the hijama person, which is me, the practitioner. It's not mandatory. So what we're gonna do, inshallah, we're gonna cover the three spots for the hijama. We're gonna start with moving cupping. So there are three ways of moving cupping. I'm gonna go through it right now. So what we're gonna do is we're gonna do one pump, only one pump for moving cupping. We don't want it to be very tight. So we're gonna do one, and we're gonna ask the patient if he feels good or not. 1x is too much, so we're gonna do half, so we can move it. So we're gonna move the cup. So three ways we're gonna move the cup. We're gonna do it horizontally and vertically, and then we're gonna do a circle. So what we're gonna do, we're gonna cover the spine on the right side 3 to 7 times. We'll go all the way up, all the way down, all the way up, slowly, all the way down, 3 to 7 times. And at the same time, try to talk to your patient. His name is Ali. Ali, everything is good?
Yeah, perfect.
Yeah, so we'll make sure he doesn't fall asleep. And we're gonna move it next to the spine area. Then we can start doing the right side. We're gonna cover horizontally and try to go through all the way to the arm, to the shoulder, arm to the shoulder, back and forth. Try to cover all the areas. We need the blood to start coming up. As you see, you can see some red spots. That's mean the blood is start. It's a good sign actually. So it's for the blood circulation. We're gonna move it down by the ribs. Try to go slowly. I'm sorry, I'm going fast, but go slowly. Reach 7 times. And at the same time, we can say Bismillah. We can recite some Quran. At the same time, we can ask the patient if he wants to read some. We recommend to talk to your patient. So we talk to them, don't definitely recite some Quran on your own. You don't need to be out loud in your heart.
Okay.
Trying to cover all the areas. We'll go back to the Hijama Sunnah point 1. Then we're going to do the other, then we're going to do the circulation movement. So we have the vertical, horizontal, and the circle. So basically this is considered a massage for the muscles, actually the massage for the muscles. Are you feeling okay, Ali?
Yeah.
Everything was good?
Yeah.
Just try to cover all the muscles areas, the trigger point, the ribs, the chest, the liver, everything. Go to the point one. I will do the other side. Make sure the cup is not loose. It needs to be, movable. You can move it around. And then go slowly up, down, 7 times to the other side. And if you feel the cup is start getting loose or the air is coming out, just do another, release it from here, and you can do another half a suck. See all the redness? That's a good sign for the blood circulation. And we do horizontal too. Make sure to cover all the areas, shoulders, ribs, all the way to the shoulders here, neck, straps. And we go also slowly up, down, We go slowly. I need to bump it again. It's 2. Better. Doesn't have to be very tight, it just needs to be stable so you can move it around and you can see all that skin in the cup. Ali, everything okay? You feel good?
Yeah, very good.
Alhamdulillah. See, you got to do this again. Give it one quick one. It's normal that the air comes out every now and then. You just need to repump it again. So usually 15 to 20 minutes is very good enough for the massage cupping, for the dry cupping. And when we're done, we go back to Sunnah, the number one Sunnah from here. And when we finish, we just release the cup and make sure we sanitize it and put it away from the tip. Because we're gonna reuse it. So after we finish, make sure to grab some tissues and just clean up, and we'll be ready for the incisions, inshallah. So we just clean up the patient right now. So what we're I'm gonna make sure to sanitize my hand again so we can get ready for the actual incision, inshallah, for Hijama. sanitize. And everything that we use, we're gonna put in the pen. We're gonna trash it out. We're not gonna use it. So I'm gonna sanitize the cup. Make sure to sanitize your hand before touching anything. So I'm gonna sanitize it again so I can use it. And this will be in the trash too. So I'm gonna start wearing my gloves, and you can see right now. And make sure no jewelry, nothing before you start your session. No accessories, no bracelet, no watches, nothing. I'm almost done. So before we start the incision in the hijama, we make sure to we have to make sure to sanitize the whole body before and after hijama always. So I'm gonna sanitize. I'm gonna cover all the areas, especially the 3 points that we're gonna do, inshallah. And we're gonna throw it away too. We're not gonna use it anymore. After we sanitize the bags, the cups. So this is the Hijama point 1. It's literally on the T7 by the spine. This is the spine, this is the neck, below the neck, a little bit, a few inches below the neck. We're gonna do 3, and we're gonna ask the patient if he's good with the 3. So we're gonna do the first palm, the second palm, and we can ask the client. Is it good? Do you feel Ali? Do you feel okay?
Yeah.
Can I do one more?
Yeah.
That's good.
Yeah.
So he said it's good. We're gonna release. This is the first one, and this is the second cup. So the second area is here. It's literally here. This is this point 2. This is 2, and this is 3. We're gonna do the same thing, and we're gonna ask the client if he's good with the 3 palm. I'm gonna do 1, 2. Is it good?
Yeah.
Do one more.
Yeah.
3. And we're gonna release. And the same thing we're gonna do for the number 3. It doesn't have to be very accurate. You put the cups, just make sure to be close enough to the area, because the range is wide anyway. We're gonna do 1, 2, and 3. And after we're done, we're gonna cover the patient and wait approximately 3 to 7 minutes. And after 3 to 7 minutes, inshallah, we're gonna start the incision.
والله الدور اللي تحت مش لاقي.
Okay, we're back after like 3 to 7 minutes. Now, make sure every few minutes, every minute, minute and a half, make sure to check on the cups. Make sure they're not loose, and make sure the body color it doesn't turn like too much dark. So because we don't want to have any like blisters or anything like that. So it seems like the skin is turning to a good color. So what we're gonna do is we're gonna just release. Put it away. We're gonna release. Then after that, you gotta make sure you have alcohol pads ready for sanitization before we start the incision. So we start like a circle in and out around the circle like that. Make sure to sanitize everything. And we're not reusing it again. We have to throw it away. Use it once on each spot and we have to throw it away. And then you have to open a new one and you do the same thing for the other two spots. So I'm opening a brand new one. Put it away. I'm opening a new one. And clean up. And I'm gonna throw it away. Okay, this is the critical part right now. After we sanitize the 3 spots, Hijama, what we're gonna do is using a 15mm blade. This is a blade that we're gonna use to make the incisions. So we're gonna open it, tear it from here. I'm gonna tear it down, and here it is. We're gonna trash it too.
Can I see it?
Yeah, 1 second. So here, how we do incisions, this is very important and critical. So most of the people, they do this. That's not how it is. So you better make sure this is the body. We're gonna go flat. We're gonna hold it gently, and we're gonna do on the body flat like this. This is how we're gonna do it. Your body, your hand needs to be flat. And make sure before you start incision, you gotta stretch the area so you can get as much tension as possible for the skin. So we're gonna stretch, and we're gonna start doing incision from right to left, from right to left, not left to right, right to left. So, and we recommend while you're doing this, you can say Bismillah while doing it, do some Quran, and same thing. Yeah, you gotta ask your patient to do the same thing if he's willing to. So make sure when you do the incision, use the curvy part, not the tips, the curvy part. So I'm gonna stretch. We're gonna start doing. So we recommend to do like a 20-30 incision. Do you feel good?
Yeah,
You feel like he's like us poking you
a little bit.
a little bit? Okay. We make sure to we make sure we do it close to each other, very close to each other. And you can count. Three, 4, 5, 6, 10, 11, 12, 13, 14, 15, 16, 17, 45. When we're done, we put this and make sure we put it somewhere it's sanitized. So you gotta put it on the tray here. And we'll get the first cup, and we'll do the 1, 2, 3. Is it good?
Yeah.
And we twist, and you will see the blood start coming out. We reuse the same incision on the same blade, and we'll do the same thing on the other two spots. We're gonna make sure they're all close to each other as much as possible. We're gonna put the plate back. And we're gonna use the same cup. 3. We're gonna stretch the skin, and we're gonna start doing the same thing. You good, Ali?
Yeah.
You fall asleep. After we're done, put back the blade back. And we're gonna get the cover. And we're gonna do 1, 2, 3, and we twist. We're gonna leave them for like about like, this is already has been like 7 minutes. This one almost the same, and this one we just started. We're gonna give it another 5 minutes, inshallah. Then we're gonna, 10 minutes, 15 minutes. Then we're gonna release and we're gonna clean up, inshallah. We can cover the patient and just wait until the body stop bleeding out. So basically, if the body stop bleeding out, that means the body it's done. There's no more blood is gonna come out. This is what the body tells you to do, and that's it. This is the max I can give out. And we still, when you cover him, try to do some Quran. If you turn on some Quran around the customer, which is good. And make sure there's no blood contamination on you. That's very important. If you got any blood, you gotta remove them away, take them off, and put in new ones. So we came back right now. It seems like the body doesn't wanna bleed anymore. So it's a sign that means that's it. Remove the cups. So right now I'm gonna do some cleaning and make sure if you have blood in your gloves, throw them away and put a new pair. So right now what we're gonna do, we're gonna release one by one, and we're gonna use soft tissue napkins to do that. So we're gonna use this method, which everybody has his own one, but I'm gonna use this method, which is we're gonna put one napkin on the top, as you can see, and we're gonna release with our right arm, whatever your dominating arm is. We're gonna lift the cup. We're gonna release. Once we're done releasing, just hold it tight. You're gonna lift up the cup, not entirely, just not all of it, and we're gonna just insert the other napkin inside like that. And once we put all the napkin, once the napkin is in, we're gonna just move like a quick cleaner like that. And this is what we came with. And make sure right away you're gonna throw the cup away in the pan. And run another tissue. Make sure to clean up and make sure there is no blood on your hand while you clean. We're gonna do the same method in the other one. And if it happens as one of the area like this one has more blood, so we can use like a double napkin or 4 to 5 napkins to do that. Depends on the quantity of the blood. So this thing is gonna do the same thing with your dominant hand. We're gonna release the cup. Make sure to hold it tight. You're gonna lift it up. You're gonna insert the napkin real quick. Once we have it in, we're just going to lift the cup and clean. Always check your gloves while you're doing this. Because we're gonna try to avoid the blood contamination as much as possible. Last but not least, we're gonna do the third spot. This one has more blood, so I'm gonna do double napkin from the top and double from the bottom. We're gonna hold the cup and release. And go ahead and insert the other napkin in. And just gonna clean up real quick. And also make sure no blood comes on your gloves whatsoever. So after we finish, we're gonna sanitize the area first, the all three spots. We're gonna sanitize three spots, and we're gonna kind of like a bruise down the areas with some coconut oil, so it doesn't get like a bruised or something like that. Gives a lot more hydration too. So we're gonna use
Oh,
yeah. Okay. You need a second one. And this is the third one. And after we finish, you good?
yeah.
Yeah. And last thing before we finish, we just use some coconut, and we're gonna tap the three spots with cotton on each spot. Let's start. This is the last one. And we also throw it away. We do not reuse anything. The only thing we reuse is the cups if needed. But if they're on the ground or something like that, we didn't use it. And we reuse the blade only. The cut and the pad sanitization, we don't reuse them on the other on each. We have to open new ones. And every now and then you gotta ask your customer, do you feel good? Do you feel dizzy? Did you feel any like headache, dizzy,
No, no, no. I feel more energy, more
energy,
like,
relaxed?
yeah.
That's good. Alhamdulillah.